Hey everybody, Dr. Curtis here today, and thanks a lot for joining me. Today we're going to talk about the appropriateness of stretching, when to stretch and when not to stretch as it relates to having low back pain, like an acute episode mostly is what we're going to talk about today. So let's say you bent over, you picked up something heavy, helped move some furniture, you strain your low back, you have a lot of acute muscle spasm, you're having trouble moving. It's very common for when we feel muscle tightness during those situations to think that the best thing to do is to stretch. And stretching is good. Flexibility, improving flexibility is good. We all need to work on that. We all lose that as we age. But in times like this where we have an acute episode of a spine issue, meaning low back, mid back, or neck as it relates to the spine, my recommendation is going to be hold off on the stretching initially. A lot of the muscle tightness that you feel is a protective guarding mechanism that our brain puts in place to help stop us from moving, because your brain perceives, hey, there's a potential injury here. I'm going to splint this area. I'm going to create a muscle spasm to stop you from moving, to further irritate the issue. So if you try to force stretching, sometimes you can actually make your symptoms worse and you can actually prolong the recovery. So although stretching is important at the right time for the right person, so if you're having high levels of acute pain after acute injury, my recommendation to most of my patients initially is to hold off on the stretching. So what's the next best thing to do is control inflammation, swelling, either with ice and or getting prescription medication from your primary care physician or a medical physician. Those can be helpful as well. But trying to improve pain-free ranges of motion. So find things you can do with less pain or minimal pain and do more of that. So sometimes gentle walking can help out with acute low back episodes, not going out walking for 10 miles over rough terrain, but maybe walking to the mailbox, walking up and down the driveway 2 or 3 times, come back in, maybe ice a little bit, walk around the house a little bit. So short periods of activity, low load activity that's relatively pain-free, and doing that frequently throughout the day can be beneficial. So again, hold off on the stretching when you have an acute injury, and then try to increase your pain-free range of motion or pain-free activity, and then add in the stretching as the healing starts to take place and then you're having less pain, you're back to daily activities. Then you can resume some flexibility training, a little more stretching. That's a little bit safer for you to go. So if you have any questions, leave those in the comment section, and look forward to seeing the next video. Thank you very much.